Hello, everybody. This is February 19th, and it is the February meeting of the Nantucket Board of Health. As always, the meeting is being audio and visually recorded. And now I'm going to ask for any public comment that is not related to any of the agenda items on today's agenda. Meg? Are you wanting to say something?
Go ahead, Meg. Yes, I just had to get unmuted. I just wanted to ask the Board of Health if they are going to open any kind of public hearing to suggest a moratorium or a ban on synthetic turf on Nantucket. It kind of tracks with what's going on in the state of Massachusetts.
I think, although we don't really discuss public things in public comment, this would probably be a good time for me to make it clear that there is a special meeting that will take place on March the 2nd at 2 p.m. That meeting has been talked about since, I think, December, and it is going to be a meeting of experts from both the against the turf side of things as well as the in favor things. This is going to be a discussion, a roundtable type discussion among experts. Obviously, the public is invited to and encouraged to listen in, but just so you know, March 2nd, 2 p.m.
Great, thank you for letting me know that. I think the reason I brought this up at public comment today is that I don't know if the board is deliberating in private, that this is something that you are going to be looking at. I know you've had listening sessions and things like that. That is concern to me, and I just want to make sure that the health of my neighbors and family of Nantucket and the like we're all protected, and that Board of Health is to protect us without being persuaded or politics becoming a part in our health. And so I just want to the board to comment something.
Meg, Meg, I'm sorry, we're having
opportunity. Sorry.
We can't hear you, Meg.
Yeah, you're cutting in and out.
The boat. I'm sorry, I'm a boat. Sorry.
No problem.
I just wanted to sure I'm about being a part of all of this, and that, you know, is the board going to also look at this as a help to protect our, that's all. Thank you, and I'm sorry I'm in and out.
Thank you. Oh, what? I don't hear anything else. Okay, wonderful. Thank you very much. We have 2 minutes to approve a meeting that was on the 8th of January that was strictly a training session for the board and staff from the Massachusetts Association of Health Boards, MAHB. Is there any comments or questions about those minutes? All right. Yeah. Can we go ahead and approve those minutes for the 8th then? I have a motion.
Make a motion to approve minutes for the January 8th meeting, training meeting.
Second. Okay, all in favor, Tom?
Aye.
Aye.
And I.
Yes.
Yes, okay. Those are approved, and now we have a week later, we have on the 15th, there were another set of minutes. That was from a regularly scheduled session of the board.
Motion to approve the minutes of January 15th, 2026.
Second. All in favor?
Aye.
Aye. Okay, we're good. Rocky. So I will begin again what I think I said to Meg, but I just want the public to know that there will be a special meeting on March the 2nd at 2 p.m., which will be a meeting of experts in the field that will be presenting evidence to us and to everyone that will be showing potential problems with an artificial turf field, as well as why it is okay. And so that is going to be March 2nd at 2 p.m. Rocky?
I have two topics. The health department will begin implementing a deadline of close of business Thursday, the week before each Board of Health meeting every month, to submit documents for the supporting documents packet, or what we're calling the packet. This is necessary because we've been getting many requests to include things in the packet the day before or even the day of the meeting. It's not possible for us to go through the process of getting documents cleared and uploaded in that short period of time. When we see a request, and we don't always see it right away because we're not always staring at our email, we forward it to the board chair to get her determination as to whether it supports an agenda item and should be included. We then must upload the document to the website and follow up to ensure it's done. That follow-up step was missed last month with a document. These multiple steps require time and personnel that are all, and then we are all busy completing other tasks throughout the day. So we need to set that deadline of 1 week before. Now, John will continue to share email sent to the Board of Health email box with the board, even on short notice, but they will not be part of the packet if they arrive past the third Thursday deadline. Now, things can still be included or brought to the board, and they can be part of the minutes. But for the packet, the supports is going to be the week before. Second thing is, last week we released additional wastewater surveillance data on the town HHS website in the same dashboard format that we used to release respiratory illness data previously, which I've shared. Now, this newer data is focused on high-risk substances and opioids. You might have already seen some of the media reports, both locally, regionally, and even nationally. From 2016 to 2023, there were 19 deaths reported from drug overdose on Nantucket, which are 19 too many. Each one is a preventable tragedy. Now, we released this data with the goal to provide near real-time ground level information to our behavioral health partners, to implement interventions, and to medical providers. So they can learn to ask the right questions and provide treatment when available. If the release of this data contributes to even one intervention that saves a life, then it's worth far more than the $30,000 the town pays to carry out this initiative every year. And that's why we're doing it. I just wanted to remind everyone of that. And that's all I have, unless you have any questions.
I just wanted to say thank you because I think that it's really interesting and I think it's eye-opening to people about what's going on in Nantucket. I got phone calls from friends from the West Coast that had seen the information. So I think that it's good information to get out there, and I'm sure that it is a lot of work putting that in all the time. So I appreciate that.
Thank you. And I'll say also, there's a lot of good news in there. Our some of these high risk substances like fentanyl and meth and xylazine, even nicotine, they're below national and regional averages. So that's actually good news on that front.
I was surprised to see the xylazine so low.
We were too. I think that Dr. Lepre was also surprised that our fentanyl was as low as it is, but the data doesn't lie, and it's near real time. So it's within 5 to 7 days of when that sample is drawn that we actually get the results. So we're able to share those with these dashboards quickly to allow our partners in the community to provide interventions to help us in that area.
May I ask a question to the chair?
Yeah.
I would love to get, your perspective on why you think the cocaine levels are elevated above national and regional levels. I noticed that the levels for a lot of the respiratory illnesses also seem to spike really high. And so I'm wondering if maybe it's just sort of a artifact of us being a small community, or if there's another explanation for that.
Rocky, do you want to address that?
If you'd like me to?
Sure.
Sure. So this is normalized data. So by normalization, it allows us to compare our small sample to data that is collected regionally or nationally with many more sites. The respiratory data, we are very interested in individual spikes, because those individual spikes usually come in advance of respiratory illness that we're seeing in the community. So in December, we saw a spike in wastewater surveillance for flu. We saw it around December the 11th. And by about a week later, we were already hearing anecdotally how much more flu there was in the community. So we are sampling for flu and influenza, flu, COVID, and RSV, and also flu B. So I think that's a very valuable, those are some valuable individual data points. Now for the other data, the high-risk substance data, we look more for long-term trends. We know there's going to be a difference between what we see in the summer and what we see in the winter. That's certainly starting to play out now in the data as we look at it. There are potential reasons why our metabolite, or something called BCE, is lower or in line, I should say, with national and regional averages compared to the parent, which is the powder, the cocaine that's found. One of those reasons is that B's in it, it's all written on the dashboard there as to what the possible reasons are. Certainly a dumping is a possibility, and I cannot tell you what it is individual, but that's certainly one possibility. Another is when cocaine is consumed with alcohol, it changes the metabolite that's developed, and so our BCE would be lower in that situation, the metabolite that we typically see.
Thank you. And just for the record, I forgot to give my name at the beginning of the comment. So John Carl McGrady, and I'm asking for the current. Thank you.
Okay, are there any other questions for Rocky or anything?
I'd like to ask a couple of questions.
Go ahead, Jim.
So basically, the people that they're going to bring are basically going to try to convince us that they think they're on the right side, that they're going to try to convince us to let them have what they want. And the people on our side are going to try to convince us that we should not let them have it. So what I'm trying to figure out in my mind is, when the whole thing is over, it's not going to convince anybody to change each other's mind at all. They're still going to want what they want. And we still, I mean, where are we going to end up with this whole thing?
I don't know if that's a question for the board chair.
Yeah, I think
You are
it is,
talking
yeah.
about the
I think he's
turf,
talking
right?
about you're not
Yeah.
talking about the wastewater.
You're not talking about wastewater
Oh, you're
surveillance.
talking about, okay, I'm still trying to figure out people that,
Rocky's presentation had to do with the wastewater, the things that are found in
okay. all right,
wastewater.
all right, okay.
The March 2nd meeting, the special meeting that
Yeah.
that I've now announced twice, that's at 2 p.m. And that's why I want to be very clear that it's not at our usual time.
All right,
4
okay,
p.m.
fine. All right, I'm sorry. I'm
Is going to
sorry.
include experts
All right,
from both
yeah,
sides
okay.
that will bring data and data only. This is
Okay,
not an
fine.
anecdotal meeting.
All right,
This
good.
is data, and it is our job
Okay,
to
all right.
listen and see what we think.
Okay, go ahead.
Okay. Number 5
Yeah.
is a loan request at 261 Mattocket Road.
So this is exactly what you just said. It's a loan request for a year-round resident. They are in the book. We did check that. It's now an orange book, Carrie, and
Oh,
no
it's orange,
longer,
not
no
green?
longer a green one. But this is a resident and they are, the funding is for the actual system alone. I believe they've already paid the engineers separately. So the loan would be allowed under our current rules. And for the replacement of the system or for the upgrade of the system.
I see no reason not to approve that. We
Mo-
have a motion.
Seeing that all paperwork is in order and they are qualified, I'd make a motion to approve.
Second.
Second.
Okay, all in favor?
Aye.
Aye. All right, that is done. Now, number 6, for the probably more than 6th time. Dan, I think we continued it because that was what Rocky was talking about a little bit ago, that the plan did not get into our packets. Is that
Correct. So
right?
we had the
Yeah.
meeting a month ago and there was an error in the packets. Information wasn't generally there for all of you to see in a timely fashion. So we continued to today.
Right.
So I'll start from the beginning in terms of what we're here for, because it's been a while, and just to give you an update as to why we're here again. So this is the last variance request for a bedroom credit within the Wellhead Protection District, at least the last one. I believe it's on record out there right now. It's been continued several times. There's been lots of questions, as you remember, over the plan. What's the plan? What's it going to look like? What are they building? So on. So the applicant has gone back, and I'm sure you're aware, at least to some degree, there was been one meeting with the planning board already. So we've got a special permit application in front of the planning board for an elder housing community. So they've had one meeting with that 2 weeks, a week ago, I think the last Monday. So we're here before you for a variance application. The property already has Board of Health approval from you for 12 bedrooms on this property. There are 2 pending applications on this property right now. One is for a 4-bedroom design that would not require a variance. That's on the back lot. We're in front of you now to ask for the variance, to take that 4 bedrooms to 7. So depending on which direction the board goes, we're anticipating either a 4-bedroom conventional approval or a 7-bedroom IA approval, which would bring in the bedroom credits. So the project is an elder housing facility. It's 10 buildings, 10 little cottage community dwellings, ranging in size from 2 bedrooms to 1 bedroom. We've talked about all kinds of restrictions. I'll talk about in terms of what the application will look like. So it's 55 and older. That's part of the regulation. Some of these conditions we talked about, they would end up being in a planning board approval, not necessarily in a Board of Health approval. But if the planning board were to act favorably, there'd be a 55 and older restriction. There'd be a homeowner's condition set up. There'd be a condominium document set up to maintain and police as well the occupants to make sure that stays intact. Conditions we talked about with the board, that we use the highest and best treatment technology currently available, which we are doing as we speak as a septic tech units. There was discussion about prior to issuance of the CO in the house, or the CO in the septic system, that the health agents get a chance to walk through the house just to confirm that it is what it's supposed to be. So in that case, the concern is it's a 2-bedroom house. Did somebody sneak 2 bedrooms in the basement? To confirm the application is correct. That's perfectly fair. That's not a problem. You had also talked about considering deed restrictions for the bedroom count on the property, which if we have to go in that direction, we can. It doesn't impact us necessarily on our side because the permits already say what we can and can't do. But if you want an extra layer, we can do that as well. So that is a what I'd say a quick summary as to what the project is, what's before you. So the variance request, even though it's a bigger project, has to go from a 4-bedroom approval to 7 using the IA technology.
Yeah. Dan, has the properties been merged officially, or are they still separate, considered to be separate
They're
properties?
considered to be separate, but they would be merged if the project goes forward.
So that hasn't been done. So, okay. And, I mean,
It
read
would have
about,
to be done. If the planning board acts favorably on it, it has to be done. The project can't move forward without that.
okay. And, I mean, I didn't attend the meeting or anything, but, reading the follow-up meeting, it seemed that, that there still are lots of questions about the project in general, in terms of what did it qualify under elder housing, HOA agreements, stuff like that. There's a lot, there seemed to be a lot of questions and a lot of, kind of unsureness about the general project. And, I guess that kind of, has me wondering, where we jump in or where we don't jump in, because it seems like it's the questions about it are much bigger than just septic systems. That there's a whole, in terms of, is it really elder? Is it affordable? All those kinds of questions.
So I have 2 different answers. The short one is, and I don't mean to be aggressive with it, but it's not an issue here. But you're right. There are, and that comes down to condominium documents and homeowners association essentially policing to make sure it is what it's supposed to be. And that is very common language on all subdivisions and certain special permits, depending on what it is. So it's not unusual. And right now, the planning board, generally speaking, I would say, likes the application. There's definitely more detail to follow, no question. And not to pressure this board necessarily, but in terms of every other application, we're waiting on this board so we can finalize everything else. Because the planning board application itself can't be finalized until we have a unit count for sure, which is dependent on this meeting right now. So we're going in steps, and we need to finish with you so we can then go back to the planning board and say, yes, we have X number of bedrooms to work with, we have X number of units. Here's the rest of the detail. And we can't provide that yet because we don't have an answer.
And are there any lawsuits that have been filed by any, like the neighborhood groups or anything yet? I'm just gonna get there. I know there's concern, so I just want to know, has anything been done other than just expressing concern?
Not that I'm aware of. No.
Okay.
There has been no permits issued for someone to file a lawsuit
I guess,
against.
there's still a legal thing to
Correct.
attach to. Okay, thank you.
My concern is just, I think something that Mr. Cooper said a couple of meetings ago of approving something that we don't know. He said, I think I've never approved something without knowing exactly what was going in there. And so I guess I would have a hard time approving 19 bedrooms without the assurance of what is exactly going there. And because you don't really have, like, what if the planning board changes their tune and says, no, we don't want that there, or no, it doesn't fit. I guess I feel conflicted on that part of it. I don't know if you have any more things.
The
to
only
share about
answer I
that.
can give you on that is no different. And it's no different than any application that comes before you or any other board where if someone proposes something, maybe it gets approved in one capacity, not in another. If it fails in one capacity, but it's approved in another, the whole project could be essentially derailed and then turn into something else. Depending on what that something else is, it may have to come back before all the different boards all over again. All I can tell you is the project in front of you is what's proposed. That's what's in front of you. It's in front of the planning board. And that's all that's what we have to act on. And if there is a substantial change, then it's not outside your purview necessarily to ask that it come back to you if there's a substantial change, whatever you approved. If any changes we make to the plan have to come back to your office for office review. And depending on the substance of that change, may have to come back to you as a board. I'm not sure If we make some minor edits to a plan, I think the staff would approve it in the office. If we come back to the staff with, I don't know, instead of 10 buildings, we come back with 15 one-bedroom units. Let's say, I'm just throwing this out there. That may be a big enough change that it should come back to you as a board. Say, wait a minute, this is not what we approved. We want to review it again versus something the staff would approve. If that's the best answer I can give you, I think.
I have a couple of comments. I think what might be a little confusing is when you began, you said something about there are two plans that have been, maybe I heard this wrong, have been submitted. One is for a 4-bedroom something on this property, and then one is for this elder community. Oh, can you clarify that a little bit?
Right. So when this whole process started, there were multiple applications filed. There were applications for all the variants we're talking about. And then there was an application for a standalone 4-bedroom system on the back lot that is still pending. Essentially, it was dependent upon if this did not get acted upon favorably, the owner had that other option to pursue with just 4 bedrooms with no waivers. That application is out there. If you act favorably on this, that application goes away.
Okay. Now, the second thing is that we talked about, I know we've talked about from the very beginning of this project or this elder 55 and older thing, putting a deed restriction on that they could only be 2 bedrooms. We talked about that, and I think, as I remember, the board was in favor of having that happen. There was also a conversation about whether we could put how many people you could have in the house, so that somebody couldn't somehow in the 2 bedrooms squeeze in, 5 grandchildren or something like that. And I just want to throw that out to everybody as a possibility that we might want to think about, because it's my understanding that it doesn't matter how many bedrooms you have, really. It matters how many people are using the plumbing and using the wastewater and all of that kind of thing. But anyway, I just want to throw that out. And the other thing is that I would like to say, because I think this would be reassuring to people on the board who have questions, that if we approve it, we are only approving this plan. We are not approving some other plan that might arise should there be a change of heart, change of mind, the planning board says no, or anything like that. If that were to happen, I would want to say that it would have to start over and come back to us.
Can I just add a couple brief
Yeah, go
things in
ahead.
that? So in terms
Go
of the restriction, what I would offer you to consider, instead of a per unit restriction, I would say consider a site restriction. So if the site is, if the board would act favorably on this application, that would grant the site, the property, 19 bedrooms. It'll be easier, I think, to enforce and deal with as a whole number rather than trying to break it down by unit. I'm just throwing it for simplicity. You don't have to do it, though. Just a simplicity thing. You could consider it that way. And in terms of the number of people in a building, I'm not sure how would police that. I'm not against it. I'm just not sure how you'd actually.
Well,
pursue it.
I think we would make the restriction, and the condominium association would have to.
But let me say something. Why don't you just make it simple and give us a plan that you want?
I think they did.
So
Just give us a plan that you want. And if we approve it, fine. If we don't, we simply say, look, this is not going to work. And it seems like you have 2 different plans that you want. Is that right?
No, there's only one plan. I don't know if you can put it up or not.
Okay, well,
Yeah.
if you have one plan, give us that plan.
It's here.
Madam
Okay?
Chair.
It's in your pack.
All right, so will it work? Will this plan work?
Madam Chair? May I
Yes,
ask
go ahead,
may I ask Dan
John.
a question? Dan, wouldn't on the number of bedrooms, wouldn't the permit restrict that anyway?
Yes, so the permit is going to allow X number of bedrooms. Anything added to that is just another layer. It doesn't change anything.
Yeah, so
essentially.
I think any restriction that we do would be completely redundant, and I think we're getting awfully close to talking about gathering permits or something, which is really not something we should go down.
But this is 19 bedrooms is a lot, and I have struggled with this the whole time. Because you are correct that it has changed multiple times. And I think that you just said there are two plans out there. If this one were to get approved, the other one would fall away, but there are two plans out there, correct?
There is not a second plan. There's a second application. The only difference being the number of bedrooms. We had 7 or 4. It's still the same plan. The only difference would be is if we had to go from 7 bedrooms to 4, are you likely to see 1 or 2 buildings disappear? But I can't give you a separate plan for that because I don't know which one I'm acting on.
So it would be. So the development would either have, is it 12 bedrooms or 19 bedrooms? Is that what I can't remember.
So right now, there's a 12-bedroom approval.
That's by right, correct?
That's already in place. That's done. I believe the applicant is entitled to a 4-bedroom approval on the back lot, just using a conventional system, just straight out conventional 4-bedroom permit. That would bring us to 16. So when I'm looking at from a regulatory standpoint, application is either 16 or 19. And that's what we're talking about, the difference. So a variance request to have the 19 or not.
Yeah, and if I get, part of the options are, if it wasn't approved, you would just go with standard systems.
If so, if the
Conventional system versus an IA.
So as it stands right now, the 12-bedroom approval requires the IA system. A 4-bedroom approval on top of that would not. So you could realistically have 12 bedrooms out there using IA systems and 4 bedrooms not.
And that
versus-
4-bedroom is at the landlocked lot.
Correct. So in that case, you'd have 4 bedrooms untreated versus 7 preferably would be treated.
To me, that undermines the whole point of why we're talking about the regs. I mean, that does not seem reasonable and prudent to have them do a 12-bedroom IA and then a conventional system and 4 makes no sense. And I think we're getting awfully close to acting like the planning board a little bit. Like our purview is the system that they want to put in and basically nitrogen loading. And yeah, so we're talking about emerging contaminants and all those things, but I don't think we can really, this kind of reminds me of our HGC appeal last night when we did this thing on solar. And I said at the end of my little speech at the end, which was like, I disagree with the HGC's decision here, but it's not my decision. We had a standard which was arbitrary and capricious. Like, that's it. It doesn't matter what I think about this project. What matters for us is whether this IA system makes sense for this property in the bounds of what the Board of Health has to do. So to me, this seems fine.
Well, I think, part of our wrestling has to do with the fact we are talking about regulations that would not, grant nitrogen loading credits in the future. And so, part of it is, I think, we're kind of, again, the application was put in well before that, so that discussion is separate, but that is in our heads that, we are looking at trying to minimize potentially any contaminants into our aquifer.
Then why wouldn't we do an IA system?
Well, because we're increasing. Well, the other thing about and one of the reasons the nitrogen loading credits is kind of funny is that you say, okay, you're going to put a conventional system and that's going to limit you to 4 bedrooms. If you put a better system in, will allow you to put more people in, which will create more flow. So essentially,
Maybe.
it does.
Maybe.
And if it's used and it negates, so the credits negate the impact of trying to reduce nitrogen into
So
the system.
speculating on how much a residence or whatever would be used outweighs the fact of that an IA system is 60% plus better. It
Well-
just doesn't make sense to me.
Well, if it doesn't make sense, why'd we do it in Nantucket and the harbor? Those towns, those sections of the towns have had those regulations in place and no one questioned
Well, I think
it.
there are reasons for that.
Well, there's reasons for it. Yeah, we've got to keep the water clean.
well,
So it's,
We
thing is-
also can't punish the last applicant or
Yeah.
overly punish the
right,
last
and that,
applicant.
right.
who's-
But I'm saying they're kind of caught right in that discussion occurred. We've been talking about this now for a year.
Yeah.
So that discussion, their application jumped in there, and it is a controversial application. We're not the only ones questioning it. It's been questioned by a
Yeah,
lot
but
of
that's
us.
not our purview. Those questions aren't our purview. That's the planning board. I watched that.
And-
That those questions have nothing to do with septic systems.
But they have to do with life on Nantucket, and we're a slice of it, and they're a slice of
But
it.
that's not our job here. I mean, clearly not our
Right.
purview.
Can,
Yeah.
I think another concern that came up during all of this is that it's 2 different lots. So one of the lots doesn't have frontage, so it's
It's landlocked. It can't be
Mm.
developed. unless
not a
it's- unless it's joined.
buildable lot is what the neighbors have said. And so it has all been joined, but not legally joined. And I think that is where it is, all of the development is really going on the lot that has frontage, not on, they're putting one of the septics, I believe, on the over the line into the area that is not buildable. So I think, and it is also a big change for that neighborhood, which I know is not our purview, but I think putting in 19 bedrooms all essentially on one lot with 2 septic systems because of the size of the 2 lots.
Three septic-
4, 3 or 4.
Three
Yeah,
septic
so
systems. Isn't it,
Let
Dan?
me just,
Three?
thought it was
there's
2.
3 systems. I do
Yeah.
a really quick rundown because I think we're starting to spread out in a lot of different directions. So big picture things. There is a lot of science out there. It's been studied, it's been proven, it's been calculated. An IA system, the quality of the water, regardless of the number of people in the house, unless it's a party, some crazy event, is still better than a non-IA system with fewer people. So the volume of water with more people, yes, is higher. No debate with that. The quality of the discharge using the IA system with more people is exponentially better than not using one. So that's, in my mind, from an engineering and science standpoint, that's a fact. That part's not a debate. In terms of what we're proposing, there are 3 systems, total of 19 bedrooms. You're talking about scattering 19 bedrooms across 100 and almost 30,000 square feet. That's a big area. It's not a point loaded system. It's not something that is typically not allowed almost everywhere. So again, what we're looking for is the variance request basically forcing us to use an IA system to use 3 extra bedrooms versus a 4-bedroom conventional, which is clearly a better it's an environmental improvement. So that's forgetting everything else. That's the really one point we're here for. If that tries to narrow it down a little bit. And in terms of all the restrictions, you want to restrict the property to 19 bedrooms? Fine, no problem. If we want to do walkthroughs, again, no problem at all. If you want to consider a condition, I'm not sure how you'd word it yet, but something along the lines of major plan revisions or changes or change in use maybe. would require the applicant to come back before the board. If that would help you feel better about the plan itself. So if there's some major change, we can't just say, oh, we already have a permit. We have to come back to you and show you and make sure it's still in keeping with what everybody wanted. If there's a way you're comfortable wording something like that, that's certainly something that you could do.
I know that that is, I think, a concern because again, we've gone through, it has gone through several iterations and, we would be acting on what's before us today. And reality is once you have, and I think you've kind of, once you have the thing for 19 bedrooms, you really can kind of juggle that technically almost any way you want. And we don't want that.
Right, so what I'm getting at,
we would, if we say that it's that plan that was up there, any substantive change would be something that we would be, feel like we were kind of misled.
and that's fair. So the
And-
only thing I would say is when if you write such a condition is what does substantive mean?
Yeah, I mean,
that's
I
a-
think, and that
just to give everybody the clear understanding of what it is. If we go through planning board and they act favorably and they if we have to move some buildings around, but it doesn't change the septic capacity, we can't anyways,
Yeah,
or
I mean-
is that substantial or is it?
Yeah. Well, I think, going from a series of cottages to maybe 3 houses.
That's- okay, so that's a different.
That's a
that's
totally
substantial-
different
That's a different type
intent,
of use.
design, and I think is part of this is the intent of what was presented, is the elder housing, some of it possibly being affordable. That's something. If it's not that, that'd be something, again, feeling a sense of not wanting to necessarily, we wouldn't be comfortable with that, I think, as a board. So that would be a substantive change in my book. You still same number of bedrooms. It is a totally different look on how those bedrooms are placed. And it might still be 3 systems, 19 bedrooms, but we have before us the plan of that little community with smaller housing and, kind of a focused purpose for, in terms of elder housing, available housing. So.
Just
Mm.
remember, the next guy that comes around that has the same exact situation they're looking at, you have to give it to him.
Yeah, no, I mean, that's.
No, we don't, because this application was long before any of the moratorium or any of the change in regulations or anything like that. So I think this, like it or not, comes in under a little bit of a different situation.
It does.
I
Yeah.
would be comfortable with approving having it go through as this plan has been presented to us today on February 19th. And to restrict the bedroom count. And I actually would want to restrict the amount of houses, or what I'd like to keep it as is a little bit of a, what do they call it, cottage colony, with multiple small dwellings. And I guess, Stan, it's how many houses? It's 8 and one bedroom?
There's 10 cottages, 9 twos and 1 single.
9,
But
okay.
the only one I would ask for a little leeway on that is if we go through this process and it turns out that two bedrooms have, preferably should be 1s. So maybe the bedroom count goes up and maybe there's 2 more singles versus one of the 2-bedroom houses turns into 2 singles. I'm trying to, if a little change, so we're not ping ponging back and forth. If that's a small enough change, it's still the same project. So we're not constantly coming back, and we can come back, we will if necessary, but if that's really substantial, or if maybe a max, if you want to go at a maximum count, maybe instead of 10, maybe you say up to 12 or 13 or some other number, however, not exceeding X number of bedrooms.
I mean, that's fine. What do you guys think? I think that what I want to do is make sure that it stays as a cottage colony, a small, small houses for older people who want to downsize. And as a member of that group, I know that there are a great many people in that group who are having a hard time finding somewhere to do that. And so I want to make sure it gets restricted to that and doesn't suddenly morph into something that is different.
We'll put that restriction in it then.
So Dan is saying he'd like to have a little wiggle room. And it sounds like what you're wanting to do is have a few more smaller units than
Well, I'm not,
bigger.
I have no idea if that could even happen. What I'm trying to do is, in my mind, if we have 19 bedrooms and we stay consistent with the plan, if a 2-bedroom house becomes 2 singles, that's not substantial. It doesn't change the character of the plan necessarily. If all of the buildings went from 2 bedrooms to singles and all of a sudden there's a doubling of units, that's a whole different plan. That's a different project. We're back in front of you, no questions asked. I'm just trying to make sure we have a little bit of leeway in there again, so we're not, because things change. Some little tweak like that is likely to happen that we haven't even thought of yet. And if it's big, we're coming back. If it's not, then we're not. It's at the end of the day, it's what you're comfortable with. We have the 19 bedrooms if you end up going that direction. So that's an overall cap regardless.
Dan, what example would be, I'm just going to make this up, but like if the planning board was like, oh, well, you need such and such parking or a buffer or something like that, that might switch the configuration around. So you might have to say, instead of X number of 2 bedrooms, it might be 1 bedrooms or whatever.
That's what I'm getting at.
Okay.
Is there could be a slight, and we're just guessing. Because
Yeah.
I know you're concerned about what this is going to look like. So obviously the plan in front of you is what we're intending to do. There's always a tweak someplace through the whole process. I just want to have a little bit of room so that we can accommodate that without having to constantly go back to every board, depending on the extent of the change. That's all I'm asking.
How would we word that? Because I'm very inclined to have it be pretty strict and say, we are going to restrict it to the plan that is in front of us today. And if we were to say substantial changes, see, that could give you wiggle room, but I don't know if that's clear enough, because what's a substantial change?
Well, how about if we consider, assuming you act favorably, there's a 19-bedroom restriction. Whether you word it that way or not, that will be in place just by a permitting standpoint. Maybe something on the line of it's approved with the condition that it follows the plan as presented, with a maximum unit count of, right now it's 10, let's say 12. It's that way, it's still the same plan. If something were to change, it's still so small enough that it's insubstantial.
Yeah, I'm okay with that.
And it
I'm
has-
okay with that.
If I make that change, if it happens, it's still going to your staff, because it's still just, this plan changes that your office staff still have to review. So it's not, someone in your office will be reviewing it. They may look at it and say, wait a minute, I think this is something the board should see. So it's not going to be done invisibly. Any changes in one way or another, you will still be aware of it.
If we put other qualification, also I think about a change of purpose. If it was all of a sudden not to be an elder community, but something different. I mean, so besides the change limit of, sticking to the plan, but also if there was a change in purpose and in use of the, we'd be approving that plan, which includes the elder housing aspect of it. If that were to be taken out, that would be a substantive change for us.
And that's fine. I'm not,
Yeah, so.
I'm
yeah,
not
but-
disagreeing. I'm trying to.
Yeah, yeah, I just,
Yeah.
but that'd
Simplify.
be, just again, trying to think if there's conditions that they are clear enough that they can kind of be interpreted easily without too much.
Right. So I would avoid the word substantial.
Yeah.
Because
That's too,
we'll throw some numbers at it if you want, and then I think you're approving it per the plan with a maximum of 19 bedrooms,
19 bedrooms.
and maybe a maximum unit count or dwelling count of up to, we have 10 now, so
12, you
12.
said.
Well, so,
And to be restricted to elder housing. Correct?
That's what the application is, yes.
55 and
Yeah.
all
older.
right,
Yeah, okay. Harry, you want to make that motion?
I just want to make sure I got everything I
Alright.
want. Or anybody else can talk while
Yeah.
I'm thinking this through. Yeah. Yeah, I mean, again, I'm going, Dan has said this, I think Tom's even hinted at too, that, we have a purpose, the Board of Health, and, it's not to be a housing agency or all of that. But our concern is obviously water supply is because we are a single source aquifer, we all are impacted by what happens down there. Whether someone else caused it or not is immaterial. When that goes, we got a problem. So, obviously, I think if you've seen our discussions over the last year or even longer, that, we are really looking at how to maintain water quality because we are seeing incursions like right now, the PFAS, we are seeing incursions into the water supply that, can be dangerous. So, a lot of the discussion, but, getting down to what's before us is that's a big lot. And if the two lots are joined, it can it is allowed by code to have 19 bedrooms. Though we don't want to be a housing authority, we do only want to approve if we do it, the plan that's in front of us and nothing else. If anything changes, we would want to have a relook at that again, because that's, we're acting on good faith we want everybody else to be acting on good faith too. That being said, as much as I'm somewhat torn, make a motion to approve the variance with the following conditions, that it would be capped at 19 bedrooms with a maximum of 12 dwelling units, restricted to elder housing and subject to, we had talked about that, the walkthrough, whatever phrase, I know last month we had
A
different phrase.
walkthrough prior to issuance of
Yeah.
CO on the septic system, and the use of best available technologies.
Yeah, and because again, we talked about that, if better technology comes along, as it's being developed, you would have to jump to that.
Okay, so-
Technology, okay, so motion to approve the variance with a cap of 19 bedrooms for the two lots. Maximum of 12, maximum number of 12 individual dwelling units restricted to elder housing with a walkthrough by Board of Health and or other entities to verify, and that and the best, I can't read my own writing, best available systems would be used. Best available septic systems would be used at the time. The best available IA system would be used.
Is there a second?
Is that capture?
Second,
Okay, all in favor?
aye.
Aye.
And aye.
No.
You voting?
Yeah.
He's abstaining. Okay. So that is 3-1. You got it, Dan.
Thank you very much. And there will be no more variance applications. Thank you.
Okay. Oh, 7 and 8. This is your night, Carrie.
Oh,
Um,
okay, we are.
This
on-
is a continuation of a public hearing that has to do with the amendments to the regulations, proposed amendments to the regulations for the Hummock Pond watershed area and the wellhead protection area. And Mr. McKenna here has worked really hard and diligently trying to get these regulations the way we want them. And so before we go on to sort of the next piece, I think I'd like to ask Carrie to explain how he has amended them.
Okay.
We also have had legal advice on this, correct, Carrie?
Yeah. So,
And so some of this is legal language.
yes. So, it's historical that, kind of was talking with Dan, that a single source aquifer, no matter whether you're using a well or town water, we're all draw from the same place, and we all impact this, just as we use it, human activities impact the water supply too. It doesn't matter if you're on well or not, we impact it just by being here. And what we did is we started a discussion probably a little over a year ago of looking at the regulations, because we noticed that we have four water protection districts, but we don't have the same regulations across. And the harbor and Nantucket have had more stringent regulations going back like 2015, I think, or so, when those went in, I think right before I moved here. And then, but when we looked at Hummock Pond and the wellhead, and seeing that, at Hummock Pond, we are starting, the eutrophication, which is essentially the growing of algae in the pond, which ultimately can lead to the death of a pond. And development in the wellhead district, which pretty much sits above where we're drawing from, and many of our wells are there. So what we did is we started discussion a year ago. We went through internally kind of drafting regulations and playing with them and looking at language. And one of the things we really wanted to avoid was, and Tom brought this up earlier, about, crossing over, each board has a purpose, and our purposes intersect to a certain degree, but we have to function as what our responsibility is, which is public health. So even though housing is an issue, we didn't want to become, there were housing concerns brought up by the various entities. We've listened to them, and we also then went for legal opinion as we went back and forth with drafting, multiple drafts. And what we have before us is kind of initially based on the initial feedback we've received from people concerned with housing. What I do want to extend is that we have talked about having a direct meeting with the various agencies, and the Board of Health is open to doing that. So we would encourage that if there are any of the entities out there that want to talk about impact potentially on affordable housing, we do want to listen, and we do want to work with people to make sure that one action doesn't impact another high priority item on the island. So right now, housing is a high priority, but so is water quality. So the two, we need to find that place where they both work together. There were some changes that didn't change the intent, but again, based upon legal feedback, that we used to say 440 gallons per day per acre. Now it says 110 gallons per day per 10,000 feet of area, which an acre is 40,000 square feet. So 110 times 4 is 440. Same, no change there. Change in the language is how to describe it. We also had discussions about existing developed properties, and there was a question about, well, what is an existing developed property? And so the definition we've added is the property in which there is an existing structure and a septic system. Properties that maybe had permits pulled and then have been sitting fallow for 20, 30 years is not an existing developed property and is subject to current regulation. So we wanted to kind of make sure that if the property is existing developed already, that it has already had something done to it to make it useful, whether it's habitable for living or whether it's commercial, that's separate than a property that has been sitting with the permit that has not been used. So we wanted to make sure we cleared that up, so that the developed properties language was added to the definition. Getting back, what we wanted to do ultimately, I think the discussion was all 4 water protection districts should have the same protections. And that included limiting the affluents to 110 gallons per day per 10,000 feet of lot area, The old language was 440 gallons per day per acre. No change there. Requiring an IA system in the designated area, and those would be required to be upgraded based upon property transfer, system failure, or new construction. Same requirements that exist in Nantucket and in the harbor area. Require existing conventional systems be inspected every 5 years, same as in the Nantucket and in the harbor area. And then one of the other things that we have been kind of wrestling with is going back to the affordable housing issue, and we did add a in the special variance section, which is the end. It says, I'm just going to read the whole thing, because the Board of Health, in its sole discretion, may issue a variance from the strict application of these regulations in accordance with the criteria set forth in Chapter 2 through 3, Board of Health Administration, Article 1 and 2239. That's standard in all of our things. What's been added in this one was the board may, in its discretion, grant a requested waiver if necessary to avoid undue hardship for properties subject to conditions set forth by the Nantucket Affordable Housing Trust. Essentially, we definitely would want to work where affordable housing is an issue. The Nantucket Affordable Housing Trust, they're the folks that have set the guidelines and had the rules. Don't want to get involved with that. When they have a situation which they feel that the regulations are impacting their ability to provide affordable housing, that they can come, and that would be considered a hardship that we would definitely listen to and try to work with on.
At the risk of sounding this slightly self-serving, since it's my work, I just want to note that there are other affordable, attainable housing organizations other than the town. So there's Housing Nantucket, there's Nantucket Land Trust that I work for, there's Habitat for Humanity. There might be some others that I'm forgetting or have some ancillary. So they might come before the Board of Health with separate things. So, and they have the same mission, and they're all nonprofits. And there are some reasons why it should be done by a nonprofit, not AHT, mostly because procurement is cumbersome, expensive, and et cetera, all this stuff. Anyway, I think that I would highly recommend that that wording is tweaked for something like Nantucket Affordable Attainable Housing Organizations that are qualified, or the town or a nonprofit or whatever, something like that.
Well, I think,
and this is something that either Christy Farentell or Dylan Metchampel, the deputy.
Well, that's why we want to meet.
Okay, I just wanted to throw that out there.
But the thing, and I think it's not so much that the Affordable Housing Trust is the only entity, but they have guidelines about how they're deed restricted. They have, which seem to be, I think, across the affordable housing groups. So it's using their guidelines. But that's why we want to meet.
Sort of.
Yeah.
You're right. But
meaning that we needed guidance.
We need guidance.
Gotcha.
Can't have somebody
And I don't mean
say,
to I don't mean to
no.
hijack your speech here.
Oh, no, please. No, because that's the concern we have, is that there's entities out there that are concerned about it. We're concerned about it, and we have said we're willing to meet, but no one has set the meetings up, and we're not setting it up. We're asking them to contact us to set up the meeting, because there's so many.
I think that's been done. maybe there's a cross wire or miss correspondence. I don't know.
Met yesterday and none of us had heard. So we do want to meet, and that's the language we want to sort out, is how do we make sure that that regulations are not going to have a gross negative impact on our ability to afford affordable housing. And we have to work with the people who are doing that in order to come up with language that keeps us in the public health realm, but also gives some guidance as to how we should respond.
Understood. Sounds good.
Okay.
I have a question from the public.
Yeah.
Go ahead, Meg.
I'm sorry, I'm getting off the boat. I've been on the boat trying to listen to this meeting, so hopefully you can hear me better. But one of my concerns is that you're talking about this affordable housing, whatever the entity is, and it's for the tier 2 and these Hummock Pond watersheds. There are other septic regulations in other areas of the island that don't have any language around affordable housing in them. So is that something that the Board of Health will be looking at, if you're willing to go down this road and compromise on your regulations to protect our health? Is that something you've thought about?
Yeah, it did actually. We talked about that a little bit yesterday. Is there a need to go back and look at the other areas? But right now, yeah, right, that would be a secondary thing because these aren't regulations yet. So there's nothing to match to. If these were to go through, and again, what we had before, what I read to you is Hummock Pond
Yep.
proposal, and we would the wellhead would probably be extremely similar. If those go through, then we would go back and look at the Nantucket and the Nantucket Harbor.
Okay, I wanted to make sure because I feel like that's not right if you're just focusing on these two areas right now because you're looking at those. And I also am really concerned about the Board of Health playing politics with the health of the residents of Nantucket. The Board of Health is to act is, when I read all the information about your Board of Health, it's there to act independent of any other association. And it has been concerning to me when I see letters from the select board, letters from the planning board, everybody jockeying for their, piece of the pie when it comes to housing. And at the end of the day, it's people's public health. And so I just wanted to bring that, and that's why I wrote a letter because this has gone on for a long time, these hearings, and there's no deadline in sight. They keep getting extended.
People, whether it's an individual organization, is allowed to express an opinion about pending regulations. And, we listen to it. And I think the idea is that, yes, we can act as a sole authority, but we also need to be responsive to the needs of the community as a whole. And sometimes there is, if we listen to what people say, we may alter our judgment or opinions based upon the overall impact. But people are allowed to send letters and send calls, attend the meetings and public comment sections. And the reason why that's done is so that we can hear and possibly hear points of views that we're not hearing.
Okay.
So
well, great. Well, I appreciate that. That's why I wrote that letter, and I know it's in the packet, and I just wanted to make sure that you all got it and heard what I had to say as an impacted party. So
no, thank you, Meg.
Thank you.
We appreciate it, and everybody else's input we do appreciate too, because it
Yeah.
does. The more we hear, the more allows us to kind of get a better sense of maybe the full range of issues that are before us at any point in time.
Okay, are there any other comments? Then I think we need to keep the public hearing open because as both Carrie and Tom alluded, we're trying to get a meeting. Let me just say that this Board of Health, all boards of health in the Commonwealth of Massachusetts are mandated to think first and foremost about the public health of the district that they are representing. And I believe that we do that. However, it is very, very important to keep an open mind because I think when we don't, or if we are perceived as not keeping an open mind, then we really have not done our duty.
Yeah.
And we are going to get a huge amount of criticism and everything else. So we are making every attempt to keep an open mind in this situation. And I believe that we are trying to schedule at some point in the month of March, a meeting with the concerned parties that have to do with hardship cases relative to affordable housing and other things. So as Carrie said, we have not yet heard from them, at least not as of this morning, but we are expecting to hear, I believe, from the housing department who is organizing this meeting. And as soon as the meeting is set up, we will certainly let everyone know. So in the meantime, I think we should keep the public hearing open and not make any decisions.
Oh, yeah, absolutely.
Madam Chair, I'll just make two quick comments on just in the most general sense. So one of the reasons the other board sent the letters is to all the reasons that Carrie very nicely laid out is that there are a number of areas and goals and et cetera in the strategic plan that is the kind of guidebook for the select board and town admin and all that. And the various boards have their purview and everything that we've all stated, but they all kind of touch to both your points, they all sort of touch each other. And so yes, it would be a lot easier if all the boards like got together at the Brotherhood and discussed this out. That's obviously not possible due to open meeting law. So they have questions. So the right way of doing it is to send the boards talk about it. They discuss it. They send a letter that goes to them. Then we discuss it. Then we decide to have a joint meeting. Then it's scheduled. It's just the process. So some of this stuff seems cumbersome and slow and maybe somewhat unnecessary to some folks who don't. I'm not saying Ms. Rulli doesn't know the process. She clearly does. But this is just the way it has to be. So hopefully we can get this meeting scheduled. And the NPD, I believe the boards who sent the letters were the planning board, the select board, and the NPDC, and they'll come and ask questions, and we can address those. And some of them may be applicable, some of them may not be, some of them may be possible for amendments, some of them may not be. So we just kind of needed to talk that out. Anyway, that wasn't really to the board. That was just sort of in the most general sense. So everybody is aware of how that happened.
Right. And I do want to say, because I feel pretty strongly about this, that this does not mean that every time we have a thorny issue, we're going to have a, meeting of a whole bunch of different people and stuff. That's not how we are going to operate. But on this particular subject, it seems to be the best way to work things out.
Yeah.
And so the public, we will let everyone know. We are hoping for a date in March, and we will keep the public hearing open.
Keep the hearing open.
Yeah.
And so just to reinforce that what's out there, the Hummock Pond, the regulations are out there. These are the most current draft, and they reflect the items that I had talked. So any previous drafts that people may have seen or aside, this is now the current draft. And again, with the feedback from the other concerned parties, again, because housing is the number one priority, one of the number one priorities for the town across all the administration areas and nonprofits, that we want to proceed. We want to work together and proceed so that that we all do our jobs properly.
I have another hand up. Meg is asking to speak again.
Go ahead.
I just thank you. I just wanted to add one more thing, that one of the board members mentioned, the town strategic plan. One of my concerns, and this is what I wrote in my letter or my email, is that Mass DEP has been investigating the water quality on Nantucket for over 5 years. And, that to me is real science and real data. And I understand that everybody has concerns, but at the end of the day, our water quality and the health of our community is number one, I would hope. And so I don't know if that's part of the strategic plan. I would assume it is. And I would assume it's one of the main goals of the Board of Health. And I just wanted to make sure that my voice was heard, and for the residents of Nantucket and the health of our island and our environment.
Thank you.
No, thank you, Meg. And your information is heard.
I would just like to say, I think it's great to meet with the other organizations and hear their thoughts. And I believe in affordable housing. I do think our role is really about making sure that we have good, clean water. So I think we're sort of on this edge. And I think what was pointed out, I don't know if I said it or has been said at a meeting, that a lot of the affordable housing that is being built or attainable housing, a lot of it is on sewer, I think.
Yeah.
I think there is a large percent, not all, obviously, but a large percentage is on sewer, and this would not be an issue for them. But think our purview is very much like we're doing this to protect our water quality, because it is shocking when you think about, when you see Andrew's slide that he will show later, and you think about the fact that Mass DEP has been coming out here every 6 weeks for 5 years, and we keep getting hits. And I think that when the next information about like cancer rates comes out, I think that we are all going to be surprised, because I think there's been more of that. And I do just want to, I mean, I agree with Ms. Ruley that we just need to make sure that we're
Stay
keeping our,
focused.
which I know you are. I
Yeah.
know that that is first and foremost in your.
Yeah. Well, I think, essentially affordable housing is not an issue when you poison the pond. I mean, we can solve it really quick.
Madam
this-
Chair, just quick follow-up. Speaking of the I can't talk today. Strategic plan, something that came out of it was our very own Andrew Shapiro's position. That was put in the strategic plan and gone through the whole process, and Andrew was hired. So it absolutely is in there.
May
So I'm
I-
gonna read you
Oh,
guys something.
I have a couple of hands up from the attendees. Dylan is first up, and then we have Meg again.
Okay,
Okay.
Hi, all. Can you hear me okay?
Yes, you are on.
yeah, go ahead.
Thank you.
Thank you. Hi, everyone. Dylan from Palmer's Deputy Housing Director. I'm sorry I had to join a little bit late this evening. So I came in
It's
towards.
a little hard to hear, Dylan.
One second. I'm going to adjust my headphones. Is this a bit better?
I think so.
That's better, Andrew.
So I joined a bit late, but I just wanted to say that we appreciate everybody's comments, and we would love to meet with the board members and whoever to continue the conversation and keep discussing, and also to just reiterate that for us it's not. I think oftentimes the conversation is framed as a choice between affordable housing and the environment, and I think obviously, of course, development has an impact on the environment, but really our proposal is to continue to work together so that those things don't have to be a choice and that people aren't forced out of their homes. But these important regulations are continued to be pushed forward to protect the water supply and to protect the community. So I just wanted to chime in and say that, and I appreciate it. Thank you.
Thank you.
Meg, did
Is there someone
you?
else?
I'm sorry. I thought I saw your hand go back up.
No, okay.
Oh, I think I hit the button by accident.
Sorry.
Sorry
Apologies.
about
All right,
that.
okay. So I just want to take this opportunity to read something that is in our packet. And we've been hearing a lot, certainly from our partner, the Massachusetts Association of Health Boards. Local boards of health are authorized to make reasonable health regulations. The rule-making authority of local boards of health is broad. The focus of public health is to protect the health of every member of a community. As a general rule, the court will give health regulations promulgated by local boards the kind of deference accorded to statutes. Health regulations have a strong presumption of validity. When assessing a regulation's reasonableness, all rational presumptions are made in favor of the validity of the regulation. Those who challenge such regulations must prove that there is no rational connection between the regulation and the public purpose to be served. It then goes on to talk, I'm not going to read the whole thing, don't worry, about that the Board of Health determines that an emergency exists. The board may, without notice of hearing, issue an order reciting the existence of the emergency. And then lastly, when undergoing judicial testing for reasonableness, a Board of Health regulation enjoys the status of a statute, i.e., the court makes all rational presumption in favor of the validity of the enactment. Only when there is no rational connection between the regulation and the public purpose to be achieved, will a court strike it down? So I think what this is saying is that our job is to protect the health and safety of the community, and that courts will respect our decisions. And I think it is incumbent upon us to make those decisions wisely and without a great deal of pressure from outside forces. I just want to say that because it is we do enjoy a position that's a little different than all other boards. And that's a legal document I was reading from, not, not my own idea of what makes sense. Anyway, okay. Number 9. Short-term rental.
Madam
Do
Chair.
we need to vote to continue
Yeah.
the,
Oh, do we? Oh, yes, I guess we do. I thought once it was open,
I'll
it
make-
stayed open, but go ahead.
Just to Mary's point, to be formal about it, I make a motion to continue the public hearing of the Hummock Pond watershed regulation and the Wellhead Protection District regulation to March 19th.
second?
All in favor?
Aye.
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 I,
Okay, good. All right, March 19th. It would be wonderful if we could have this get together before that.
Oh, yeah.
Short-term rental regulations amendment proposal. So what this is doing is trying to clarify.
Madam Chair, if you want me to
I
go
would
ahead and-
love that.
All right. So Town Bylaw, Chapter 123, established the legal requirements and prohibitions for short-term rentals. So Chapter 338, which is the Board of Health regulation, provides the specific operational regulations that the Board of Health uses to administer and enforce those requirements in 123. The Town Bylaw authorizes the Board of Health, with the approval of the Select Board, to put into effect regulations to carry out and enforce the provisions of Chapter 123. And under Chapter 123, short-term rentals are strictly prohibited in dwelling units owned by a corporation. And a corporation includes any entity taxable as such under the Internal Revenue Code, including Massachusetts business trusts. Short-term rentals are also prohibited for units owned by a partnership, real estate investment trust, or any similar entity that pools funds from investors and is engaged primarily in investment activity. What is being proposed is an amendment to the Board of Health Regulation 338, which is included in your packet and identifiable as highlighted text, that seeks to address corporate control of homes owned by LLCs or limited liability corporations. The request is to open a public hearing in March to consider this amendment. If the board chair agrees, town council will be available at that meeting to respond to questions. And leading up to that, we will publish the required documentations in the local media.
Madam
Okay.
Chair,
Yeah,
Rocky, I'm assuming this was John Giorgio's work?
Yes, this
Yeah,
was drafted
okay.
by town council.
Okay, so John
And
knows
they-
more about this issue than nearly any human.
yeah.
And
So-
and I think the town council will be available. I'm not sure it'll be John. I'm not sure John will be available, but I think someone who's worked significantly on drafting this amendment would be available for answering questions.
Was that your question?
Yeah.
Oh, okay. Okay. So
Is
can
there
we
any,
have a- we have no choice. We have no choice. It's in our lap, so we have to, it's ours.
This seems like a clarification. Is that, it's like. is
Yeah,
that right?
that's exactly what it is. It's not specifically addressed in 123 currently, but 338. So this will add language to addresses that kind of that unknown around corporate control of LLCs.
Yeah, I think this will make sense when John explains it next month.
Yeah, I think it prevents a
Fully.
loophole,
Yeah.
as I understand it.
I would make a motion to schedule a public hearing for our March meeting.
Second.
I second that.
All in favor?
Aye.
Aye.
I,
Okay. Then that's on the agenda for March 19th. This is going to be a crowded March 19th.
Go back to Australia.
Yeah, exactly. That's it.
Oh, it's a live mic? Oh.
Oh, boy. Mhm. Okay, are you around, Andrew? We've gotten to number 10, which is environmental contamination administrator update.
Yes. Hi, everyone.
Hi, Andrew.
Andrew Shapiro, Environmental Contamination Administrator. Jericho, could you please share my slides? And I can't tell if you're sharing them to the in-person group, but
We're
I can't
almost
see
there.
them online.
Don't start.
Okay, great.
Okay, getting there.
I'm seeing the packet, but not the individual file.
ECA update.
That looks pretty good. All right, and Jericho, feel free to go to the next slide, please. You can all hear me, okay?
Yeah.
Great. I'll start by saying that preparation of these slides and data update does take a bit of time. So I did freeze the data a little bit earlier than I usually do. There's a long lead time with preparing the materials and then getting them into the packet on time. So I'm reporting on a smaller set of voluntary and Board of Health regulation data than usual. Since the last time I provided an update, we have 3 new data points in that bin. So we have 1 detection below the PFAS 6 drinking water standard and 2 samples that were non-detect for the PFAS 6. But the most important data for this update comes from Mass DEP. So back in December, Mass DEP was on island and they were at the Fulling Mill area where we had previously gotten an imminent hazard detection. Some of these folks already had treatment. And so from Fulling Mill Road specifically, we have 7 samples at 5 different properties. I'll present the first one at 347 parts per trillion for the PFAS 6. This is a really high concentration, a concerning concentration. It exceeds Mass DEP's imminent hazard threshold by a fair margin. This is the sample that kicked off the whole, or this is the house that kicked off the whole Fulling Mill investigation. Previously, this had tested at 106 parts per trillion. So it is considerably higher in Mass DEP's sampling. Mass DEP has a couple of theories about why the data may be so different from when it was sampled previously, perhaps because it's a seasonal residence, but ultimately we don't know the answer to that. This property does not have access to town water. Mass DEP has indicated that they will be providing a POET system to this property, though, to mitigate the very concerning PFAS levels in their water. We have another property that tested above the imminent hazard threshold at 162 parts per trillion in an untreated sample, but with a treated sample tested at 80 parts per trillion, which is just below the imminent hazard threshold, well above the state standard. So, not as high, but still pretty concerning. This is a good reminder that not all treatment systems are designed to remove PFAS. Clearly, this removed some PFAS, but not enough. Depending on what type of water quality issue you have, you may select a different treatment system. Unfortunately, this one does not appear to be removing PFAS to a satisfactory level, though. We have another property that tested at 86 parts per trillion in an untreated sample, but in a treated sample, fortunately detected at or was sampled at non-detect for the PFAS 6. We have another sample from Fulling Mill Road that tested at 57 parts per trillion, still well above the state drinking water standard. Lastly, on this same street, we have a non-detect. Not too far away on Pulpus Road, up gradient, but still not far away from these other samples, we have a non-detect as well. We've seen this pattern before where we have very, very high concentrations in one area, and then not too far away, we have low concentrations or non-detect concentrations. And we're not going to flip to the map quite yet, but based on our new map template, we'll be able to see that. So we'll get there in another minute. Mass DEP has indicated that they may consider resampling in this area, in particular because of the highly variable concentration that was seen at the first property. Mass DEP is also continuing their sampling on Hummock Pond Road. If you remember, there are a handful of imminent hazard detections in this area. They were able to get in touch with another property owner in that area, and they detected PFAS in that sample, which you don't want to see, but it was below the state standard. So compared to some of their neighbors, tested at a relatively low concentration. Going back to the filter issue, not all filters are designed to remove PFAS. Now that we have the new filter fact sheet that I shared at the previous Board of Health meeting in January, I do send that fact sheet to everyone who has a detect of PFAS. That includes folks who achieve the state standard, but nonetheless have a detect of the PFAS 6. And so I've forwarded that fact sheet along to these folks. Jericho, next slide, please. This is the map. And if you don't mind either zooming out or just kind of scrolling over to the Fulling Mill area. So you can see new detects above the imminent hazard threshold in red in this area. You also see a mix of orange, which is above the state standard, but below the imminent hazard threshold. And you see some yellow as well. And so we say it all the time, but PFAS can be really variable over a short space, which just highlights the importance of testing for PFAS. And fortunately, we're able to see that borne out in the data now that we've switched over to this new mapping template. Jericho,
Andrew,
if you
do
could.
we have any sense of what it might be from?
Unfortunately, we do not know what the source is in this area. It's a pretty low development area, so it is a bit of a head scratcher, but we don't know at the moment.
Sorry to interrupt you. Has Mass DEP are the ones that are testing this area, correct?
Correct.
So have they done any of the fingerprinting of the PFAS that's being found there?
Not that I know of at the moment. Jericho, if you could go to the next slide, please. Here's our running tally of properties that have been tested. We've exceeded 550 properties on the island that the health department has data on. We have more samples than are shown here. For each property, I just show the max detect. So in the case of some of these properties on Fulling Mill, they have different test data that fall into different categories. If you remember, one tested at 80 and then later tested at 0 or non-detect with the filtered sample. So as that appears in this data and on the map, it is entered into that data set as an 80 rather than a non-detect. We want people to be aware of the PFAS in the ground. And so we're trying to show, the groundwater to the extent that we can, rather than what people are exposed to, just to, be transparent about what is out there in the ground. Next slide is
Can I
yeah,
ask a quick question? I'm sorry. Can we look at that
please.
map again?
Yeah.
I'm just
Yeah.
wondering, like, I know we're focusing on there's areas. What about on the,
Yeah, let's look at the whole map.
yeah, I would love to see like out. Can you focus in on like Sconset and Tom Nevers? Can we see more? I'm just curious because we haven't heard of anything high there, and I feel like I see some yellows, but I'm just not sure. So
Oh.
Yeah, there's a handful of yellows. Sconset's got
And-
a yellow. Tom Nevers has a yellow.
so the
So
yellows are
PFAS have been detected there.
What's yellow? Say that again. Andrew?
Yellow is a detect below the state standard. Still
Okay.
potentially concerning, but we do try to focus
Okay.
the presentations
Green is
on
no
the highest
detect.
concentrations. Green is non-detect for the
Okay,
PFAS
got
6.
it. And why is that area got purple around it?
That's the airport disposal boundary.
Right, of course. Yeah.
Yeah.
Thank you.
Any other questions on the map?
Yeah, Andrew, quick question. So, we looked at the treated, untreated. It seems as though the filter capacity is about 80 it can handle, because the one went from 160 to 80, the one went from 80 to 0. So it seems as though the filtration systems probably have a capacity of being able to handle, reducing by about 80 parts per trillion. I mean, that's a
I
small
don't have all
sample.
the
It's a small
details.
sample, but that was, it stuck out as being, both of them were decreased the parts per trillion by 80.
Yeah, I don't have all the details on the exact filter configuration at those properties. I don't know if they're designed to remove PFAS, to be honest.
Okay, or if they're the
I
same
don't have
systems.
that system information, or if they're the same system. So
Yeah,
I
okay.
would likely not jump to that conclusion.
Oh. Thank you.
Okay, moving on to slide 5. This is our histogram that shows the distribution of the data. Again, we mostly talk about the exceedances of the state standard. Having any amount of PFAS can still be a concern. So, this shows the full distribution of that data. Last thing I have is a fact sheet on PFAS exposures. This is a final fact sheet that's already on our website, already in use. We have had some great speakers come through the room that you're all sitting in at the moment over the past couple of months. And we're trying to memorialize what great information they've given us. This is a little more accessible than the YouTube videos that are up on our website. And so we're just getting it down into a fact sheet. And I just wanted to include it for the board's awareness. That's all I have for my presentation. Of course, happy to answer any questions.
I'm from the boat, guys. I made it. So hopefully you can hear me. Andrew, great presentation. And I really feel for those people that had those high numbers in their wells. What is the protocol now for the Board of Health when people are getting these detects? Are you sending letters to residents on wells in the area? Do you just call? I know in Fulling Mill, because I have a friend that lives there, he said they're all talking as neighbors. But does the Board of Health have some program whereby you're reaching out to people? I know Mass DEP, isn't required to, but they send letters out for testing, but they aren't required
Sure.
to notify people.
So, to people. Sure. So, everyone who has a sample, I reach out to them. So they have all heard from me. But, in of letting abutters know, back, I think we got this initial data point in September. And, within a couple of days, I sent out a letter to the abutters, everyone within 500 feet to let them know about this imminent hazard condition. That was ahead of Mass DEP's letter they sent to within the same radius. So everyone within 500 feet has ideally heard from both me and Mass DEP. Um, the new data that we have suggests that the contamination is relatively localized. So I haven't sent out any new letters because there are no new abutters within that 500-foot range. But of course, we're monitoring the situation. If there is a new detect, then we'll rethink that.
Great, thanks.
I have a question, and I don't know if this is something it would be super interesting since more people are starting to get their blood tested for their PFAS levels to see. I mean, I don't know how you would get that data of like, are we seeing people whose levels, I think, I'm trying to remember what the average firefighter is, but if we're seeing people who live at these residences who've been exposed, like what are the blood levels on people? That would be super. I know that's not a Board of Health thing, maybe, or it's a health I just think it's an interesting thing, like really working with, I don't know if you've met with any of the doctors or nurse practitioners at the hospital. I know that Dr. Leprie's office is doing a lot of testing of levels and counseling people about what do you do from here, depending on what your levels are. And I just think that would be an interest, and it would be interesting to know, like, do we have a lot of people that have elevated levels, and do we need to work with the hospital about beefing up what they can get, what they're giving out, or is it not really an issue? I don't know. And how deep the wells are.
Yeah, I can say that, we've reached out to the hospital to give them guidance on how to talk about PFAS levels in people's blood and how to access the codes. I'm very much interested in kind of the average PFAS concentration in people's blood on the island. It's actually kind of tricky to calculate an average, but in terms of individual data, that's tricky for a health department. I don't think our IT systems, can protect that kind of personally identifiable information. So it's complicated, even though it is very much of interest.
De-identified.
Yeah.
Yeah, I think what that would require potentially is a study rather than being able to just pull the information because from local providers because of HIPAA and their requirements around privacy.
I think along many, many years ago, they used blood that they obtained from a health fair to screen for tick-borne diseases. And I don't know that the health fair takes blood anymore, but that could be an interesting.
Yeah, again, I think that's a study.
Yeah. Oh, yes.
Require a
Yes. A
protocol,
study. I think
require
that would be.
IRB and
Yes.
all the things that goes along with the study.
I just had one more question. Since you were talking about blood and stuff, I was thinking about the other day, with all the deer hunting and the deer processing, are you guys testing the deer meat? I know in Maine, there are several counties where the PFA levels in the deer meat is so high that they advise hunters not to eat the deer that they kill and harvest. So I just didn't know if that was something the Board of Health was considering with the new program that's happening on island, or if they've even looked at deer
That's
meat or the
interesting.
blood in deer. I mean, it's a real thing in Maine. Yeah. Oh, maybe Jerk.
I can speak to the main thing. There was a stop order due to one test. They went back to hunting in those particular areas because I don't believe the PFAS levels were continual identified. They think it was a point exposure.
Okay.
I do know that the Massachusetts wildlife authorities at the state level do PFAS surveys on deer. I do not know of the result of their data, and I could reach out and figure that out.
I just was wondering if the Board of Health was.
It would be super interesting because when they come down, their deer biologist swabs them all for the chronic wasting and COVID. So at the deer checking station, and I don't know if they're coming down for the extra hunt or not, but that would be something interesting or to collect.
I do know it is a thing that they are discussing and that is something that's being monitored. I can reach out to the individual involved.
Can testing be done at the processing thing? I mean, is that too far down the line?
The type of molecular testing is not something that is going to be able to be done at
That it has to be done at essentially the point of the kill or a live specimen or.
Collected, preserved, and sent off to whoever does the blood tests for.
Mhm.
It's not-
Yeah, but I'm saying the timing of it, it has to be from a live deer, a freshly killed deer that's been refrigerated. I mean, where?
Jericho, I can't hear you for what it's worth.
I got to turn my mic on. Where was I? I don't know the sample collection protocol for it. I would assume that it is a temperature controlled blood sample taken from a fresh kill. But I do not know that off the top of my head.
Okay.
I would bet that it could be, I don't know, but I wonder if it could be collected at the deer checking station when they come for a week right after Thanksgiving and people bring all of the deer that they kill in to get tagged. So they weigh them and measure them and age them. And
Yeah.
a lot of them still have ticks on them. So I would imagine there's still blood there.
Again, if that'd be something, again, if it would be easy enough to add that somewhere in the protocol, but it would be, it is something to find out. I mean, if it's doable, I'll phrase it like that.
I will defer to the Fish and Wildlife Department on
I
that
mean,
since they're the state's deer. I know that it is an active subject of research there, though.
And I would actually think it would need to be a live deer just because once the deer is dead, blood starts coagulating.
Yeah.
It's deoxygenated, and I don't know how that affects the tests or the other sensitivity of the test. So, but it's a good question.
Yeah, I mean, just a question.
Yeah, I don't want to get too far into this just because we don't have a protocol, but the important thing to test would be the meat, because that's what people eat. So that's the most important thing to test. And obviously we don't have any protocols, but if the folks doing the deer processing plant are interested, I'm of course available to help them.
Okay.
Okay, well, thank you, Andrew.
Anybody have anything else? No? All right. Good. Can we? have a
Motion to adjourn?
Yes. Second,
Second the motion to
Okay.
adjourn.
all in favor?
Aye.
Aye.
Aye.